Okay, the next application exercise we're going to take a look at is Duchenne's muscular dystrophy. I talk about Duchenne's because it is the most severe and the most common. Muscular dystrophy is a genetic disorder. It is a gradual degeneration of muscle fibers and skeletal muscles. We see a progressive weakness and wasting of skeletal muscles with increased disability and deformity. We see this in about 1 in 3,500 male births. Signs and symptoms of muscular dystrophy would be delayed walking, waddling gait, walking on tiptoes, speech and swallowing difficulties, and weakness. Typical lifespan for them is to live between 15 and 25 years of age, and their death typically results from respiratory or cardiac issues. Okay, let's take a look here at our scenario. We have a child diagnosed with Duchenne's muscular dystrophy 2 years ago. He is now confined to a wheelchair and often needs supplemental oxygen to maintain adequate oxygenation. He's admitted to the pediatric unit with bilateral bacterial pneumonia and is receiving IV antibiotics. What assessments will be needed daily for this child? On mine, I have respiratory assessment, obviously lung sounds, any signs of distress, how's the O2 sat. We would take a look at the child's skin integrity every day. We know that he is wheelchair bound, so it's up to us to turn and reposition him. I would check the IV access for patency and infection. He's already at a high risk for infection because he can't cough well. Don't forget, it is skeletal muscles. They're have increased disability, progressive weakening, and wasting of those muscles. So think about all the muscles that are involved with our respiratory system. So high risk for infection in the lungs because they can't cough well, they have a lot of drainage, things like that. What comfort measures need to be provided? I had medications, I have wheelchair comfort, I have a device used for clearing the airway after cough. There's some other things I'm sure you guys could throw in there as well for comfort. Distraction could be one. When the child becomes well enough to eat, what dietary recommendations do you have for the child and family? This diet would include high fluids, high fiber, and the fiber should be coming from fresh fruits, vegetables, whole grains. Constipation is going to be an issue for these kids. One, if they're on pain medication, and two, think of that limited movement if they're not moving around. We think about those issues. We would possibly restrict calories somewhat due to the patient being in a wheelchair. It will be better if we do keep this child's weight down. What other interventions do we recommend? Flu and pneumococcal vaccines. So we have flu and pneumococcal vaccines. What age do you think this child is? I don't think we said anything about his age. I have greater than 12 years is about around age 10 to 12 is when they are wheelchair dependent. Primary goal with a kid with Duchenne's muscular dystrophy is to maintain optimum function in all muscles for as long as possible. We do that by range of motion, play, splints, braces, assistive devices, wheelchair. Think about the housing modifications. When you have a child in a wheelchair, it's going to change a lot. Are the doorways big enough for the wheelchair to go through? How are the hallways? What height are the sinks? What height are the cupboards? It'll change transportation needs. How many steps to get into the home? We're going to need some housing modifications. Bedroom hopefully is on the first floor, and hopefully there's a bathroom. And again, think about all the bathroom modifications that we would need to do for a wheelchair as well when we think about the shower and the toilet. The secondary goal is to prevent contractures, as we know that this is a progressive weakness and wasting of skeletal muscles. It will lead to increased disability and deformity. We don't want any contractures to form. Obviously, with this disease process as well, that altered self-image or body image disturbance. So again, we want to focus on what they can do and what instead of what they can't do. And like I said before, there definitely will be support groups, and there definitely will be camps for these kids to attend as well.